Hi, today I'm going to be giving an intramuscular injection. So the first thing that we're going to want to do is verify the doctor's orders. So what we're going to be giving today is actually 0.4 milliliters of sterile water. The next thing you're going to want to do is check and make sure that your patient doesn't have any allergies to this medicine. And then you're going to gather your supplies and wash your hands. You also want to give them their 6 rights. So that's going to be the right patient, the right drug, dose, route, time, and documentation. So the needle gauge sizes that you can use in an IM injection is 19, 20, 21, and 22, and then the needle sizes are going to be 1, 1.5 inch, and 2 inches. Today we're going to be using a 22 gauge needle that is 1.5 inches, and we are going to be using a 1 milliliter syringe. So when you are removing your medication, or when you're getting your medication, you want to check it 3 times to make sure that it's the right med. So you are going to check it the very first time when you pull it out of the Pyxis machine, then you are going to check it again when you are prepping it, and then you are going to check it one last time at bedside. You also want to verify that it is not expired. So verify that it is sterile water. Now we are going to go ahead and remove our medication. First thing you want to do is clean the top of the vial with an alcohol pad. Then you are going to inject 4 milliliters of air into your vial. You are now going to pull out 4 milliliters of medication. You're going to recap your needle, switch out your needle, and now you're going to want to label your medication and for transportation. And if your medication has an antidote, you're going to want to bring that in the room with you. In this case, there is no antidote. We're now going to wash our hands, apply our gloves, and once you get into the room, you want to explain the procedure to your patient, explain the significance, why they're getting this medication. Then you are going to check their wristband for any allergies, ask them for 2 patient identifiers, such as their name or their date of birth, and you can do a focused assessment. In this case, you do not need to do one. It could be different things like labs, vital signs, pain. And some of the areas of IM injections is going to be the deltoid. You're going to go 2 fingers below the acromion process. The vastus lateralis, you want to place your hand on the upper thigh and on the lower thigh, and you're going to put it right here on the, you're going to inject it right on the outer thigh. Then there's the ventrogluteal. You want to make a V with your hand, put your hand on the trochanter, you're going to put it in between those 2 fingers, and then the dorsogluteal, and that's going to be the upper quadrant of the buttocks. So now we are going to go ahead and prep our patient for their injection. You want to swab them with the alcohol. You're going to allow for about 30 seconds, and you're going to allow it to completely dry. And now you are going to either pinch or pull the skin taut. In this case, I'm going to pinch. You're going to go at a 90-degree angle in a dart-like motion, and you're going to inject slowly. And then in this case, and then you're going to release the skin. In this case, you can apply pressure after giving the injection for any type of bleeding, and then you are going to dispose of the sharps. And that is how you give an IM injection.